And the digital recorder is also rolling. This episode of Broken Brain Podcast is now starting.
Broken Brain.
Welcome, everybody, to the Broken Brain Podcast. The Broken Brain, of course, is your weekly dose of mental health. I am your host, psychotherapist, and plastic rhino enthusiast, Dwight Hurst. Welcome. Today we're going to be talking about motivation on this episode. This, of course, is a podcast mini.
Podcast Mini is a podcast with a 7.9-inch screen.
We're going to just spend a couple special moments together talking about the exciting thing that is motivation. It's very, I don't know how to say it. It's like it gives me a drive, like I want to do something. Oh gosh, to talk about this topic. What could I say for that? I don't know. If only there was a word for it. We'll think of it together. So, motivation. Motivation is very important and subject to attack by almost any mental health disorder. One of the best known symptoms of depression is a loss of pleasure, known as anhedonia. It also goes along with that, the loss of motivation and productivity. And you hear statistic after statistic that is quoted about how our nation loses hundreds of hours of productivity and millions of dollars due to depression. It takes people out of the workforce, and in some cases, completely out of the workforce, sometimes a day or two at a time, a week or more, sometimes for years. Anxiety also will attack your levels of motivation. Interestingly enough, a little bit of anxiety is good for motivation. If you're a bit of an anxious person, you probably tend to do things quite well unless your anxiety gets to the point of becoming crippling. Most clinical anxiety disorders will be act like a paralytic, which will get in the way of productivity and doing stuff. So that also attacks your motivation. If you're a person who's a little bit on the ADHD shade of the pool, because pools are divided into shades, then motivation is also going to be difficult. You might find that you're better at starting projects than you are at following through. The manic phase of bipolar disorder also will do this to you. So those are the things that we run into quite a bit. One of the interesting things is that treatment, of course, should help with some of those things. But in the meantime, so this is in no way meant to replace treatment. But in the meantime, as you are addressing the treatment issues and you're addressing the underlying issues that might be getting in the way of your low motivation, you might find that it's hard to get motivated to do some of the things you're being asked to do during that time. So we're going to talk about 3 tips that I have for you about that stuff called motivation. There we go. Motivation, 3 main tips. There's 3 main approaches to getting yourself perked up a little bit on motivation. I'm assuming, first of all, that the motivation is attaching to things that you would like to do, but that you would not like to do. It's often been said for ADHD, for example, that it does not attack so much the ability to do things as it does the ability to do things that you don't want to do. There's lots of things that we don't want to actually do, but we want the benefit of having done. Work is just kind of one example, and there's lots of others. So with motivation, you're looking at something that you want to have done, but you don't necessarily want to do. And so we need to think about the thing that it is that we want to do. So the first one is think about this. The reward, or I like to call it the paycheck method of motivating yourself, okay? So first of all, ask yourself, what is it that I do want about this thing? Is it my homework and I really don't want to work on that project, but I really want to get an A? Then I probably need to look in my head and see, where am I spending most of my attention? Am I focusing on the big ugly thing I got to do, or am I thinking about the big awesome thing I want to get? And generally speaking, a lot of us find that the lower our motivation, the more it is we're focused on the big ugly project that is getting in the way of that thing. And if we can get ourselves to get started on that project, we can actually be quite productive. So one trick is to focus on the paycheck. What is the paycheck or reward or benefit that I want to get from having this thing done? Maybe it's an awkward conversation I know I have to have, and I don't feel motivated to do it. Maybe it's a homework assignment, maybe it's a job, maybe it's part of my job, whatever. Maybe it's insurance billing. What do I want? So in some cases, if it has to do with a job or career, that thing I want might just be money. If the thing that I want is intangible, then I need to think of a way to tangibilize it. If it's a good feeling, then I want to really focus on that feeling. Think about it as if it's a thing right here just waiting for me that I can have, and I'd try to spend more time thinking about the reward or the paycheck. That is one method. I will say, in my opinion, probably the most common method that people will use when they try to convince us to have motivation. And so for some people that works, for some people not really. But if you are going to try it, the psychologically appropriate way to try it has to do mostly with where are you spending your attention, not necessarily just knowing that that reward is there and then that's it, but it's a day-to-day, moment-to-moment division of your attention. That's the therapeutically way the therapeutically way. That's the name of a not best-selling book probably that I'm going to make. The Therapeutically Way. It's a sequel to Cowboy Way with Kiefer Sutherland. Anyway, so yeah, the way to do it that's different than just someone saying, well, come on, get over it and you get paid later, is to actually moment to moment be aware of where you're spending your attention. Okay, so that's it. That's it for number one. Number two, this is going great. Number two is reframe. Reframing the way that you see the thing. How do you look at it? In the annals of dialectical behavioral therapy, of which those of you, if you're a frequent listener to the podcast or watch any of these videos, and I hope that you are, then you know that I'm a big fan of dialectical behavioral therapy. Well, one of the things that is one of the old the old saws of DBT is to tell yourself, if I can change something, I'm going to work on changing it. If I can't change it, I'm going to work on changing how I feel about it. And that's the next sort of step that we're going to talk about, changing how you feel about it. So the first thing we're trying was to give ourselves an incentive of something we will get eventually. This second one is trying to look at the thing I have to do, that discussion, homework, chore, job thing that I have to do, and trying to see if there's not any way that I can change the way I feel about it. Is there some element in there that I can become passionate about if I look at it the right way? Is there some way for me to find joy in the endeavor? I had a boss once. Yeah, it's true. I've had several. But I had a boss once who sat me down and she said something that was very, very, very useful to me when she told me it was a kind of just one of these job review. It wasn't an official job review. It was just conversation. And she made this comment to me that she said, how do you like your job, and what do you like, what do you not like about it? And I'd known her long enough that I actually answered honestly, and we talked about it. And she said to me, my goal for you and for all of my workers would be that you get to do as much of the things that you're passionate about as possible, but that you also get to be good enough at the things that you don't love about your job that you are proud of yourself for how good you are at those things. So in other words, take the things that you hate and find some pride about being able to do them well. And this is really good advice. Doesn't mean that I don't hate things anymore. It doesn't even mean that I don't avoid things anymore. I struggle with this motivation level dealy that I'm talking about right now. But it is one thing to think about. If nothing else, you can be proud of doing something hard that you didn't want to do. But if you get more clever than that, you might find that you can find something to be passionate about inside of whatever it is that you're doing. Maybe you really value talking to people, and if this has something to do with a discussion you have to have, maybe you don't want to have that discussion, but you know you're going to feel proud of yourself while you're doing it, you can focus that attention while you're having the awkward discussion on, hey, I'm doing this. Good for me. I didn't want to be here, but I'm doing this anyway. And maybe that, instead of just focusing on the paycheck, is also going to focus on the pride and enjoyment of the job well done while you're doing it. Kind of a thing. Another, it's kind of sub part of this number two, we'll call it 2.1, I don't know, 2A, 2 something. Subsection 2 is trying to be clever. if you can find a way to be clever about it, and this is kind of like not just reframing, but reinventing the thing that you're doing as well, and asking, is there a way I could be doing it differently? That also naturally leads us into number 3. Number 3 is pretty useful, I would say. Ask yourself this question: is my lack of motivation a problem? Or is it a solution? Those of you, once again, who have listened to the podcast know that that's a question that's come up many times. A lot of our guests talk about this, and it's become one of my favorite therapeutic questions to ask myself and clients and people on the show. Is it a solution, or is it really a problem, or is it a solution? A lot of times, things that we are doing that get in our own way are actually an attempt at a solution. If I find that I'm drinking too much, or avoiding intimate conversations with people, or other things that we usually would think of as unhealthy, even becoming suicidal or self-harming, those things can be actually the brain trying to get me out of a worse situation. Maybe I'm drinking too much because I feel awkward. Maybe I'm avoiding intimate conversations because I don't want to be embarrassed or ashamed of myself. Maybe I'm becoming self-harming or suicidal because I just am tired, I'm in pain, and I don't want to be anymore. So therefore, none of those are healthy solutions. They don't really solve the underlying problem. But one of the things you might ask yourself is, what is my lack of motivation doing for me? Is it keeping me from doing anything that might be scary or hard? One of the most common reasons that we have low motivation, for example, is what I call the overprotective inner parent, which is actually just, we all have kind of an inner child. Think about this as well. Not only do you have an inner child, but you've got this inner parent living inside you, sort of this logical, parental figure inside your own brain where you're telling yourself, hey, let me take care of you. I don't want to get hurt. I don't want to get scared. I don't want to be afraid. I don't want to be in pain. So therefore, don't do anything ever. And you get almost the same dynamic of a parent who's like, I don't want my child to be abducted, so I'll never take them anywhere ever at all, ever. That's not the best plan to avoid child abduction. I think we all know. Finding Nemo proved that for all of us. And many of us would never dream of actually doing that to our children. But we would dream and make that dream a reality of doing it to ourselves over and over and over. And sometimes that low motivation that you're finding could be actually because of another feeling. So kind of what you do with that is you ask yourself, what is my motivation accomplishing for me? Is it protecting me from something? Is it an attempt at an unhealthy solution? And if it is, in fact, that, then I need to ask myself, what do I feel about this? What emotion might be going on underneath this thing that I am avoiding doing? When I am having low motivation, what is the feeling involved in it? Most often it's fear. If I'm afraid of something, it's hard to do. And it might be a little counterintuitive because maybe it's a thing that I want to do very much. Maybe I want to create content online. Maybe I want to create art. Maybe I want to write anything, write poetry, write fiction, write nonfiction. And every time I sit down to do it, all of a sudden something happens. And I may think I have a motivation level problem, but in fact I may have a motivation level solution, which is as long as I don't write anything, create anything, paint anything, sing anything, nobody will judge me. Maybe I don't want to make this video on motivation because people might be mean when they see it in the comments section, or maybe nobody will watch it. It's just me talking at this thing and the air around me in this empty room, and that's all that will ever hear this, and it's no good to anybody ever. And so I just don't do it. And if I misattribute that to a motivation problem, then I may never actually think about or try to resolve those feelings of fear and say, how do I really feel about this? Do I really want to do it? Can I face that fear? And that way, when my motivation level seems low, or I just want to get on Facebook instead of do the thing that I was planning on doing, I know, oh wait, I am avoiding and feeding into that feeling of fear. And I can try to fight it differently than if I just thought it was a motivation problem. Yeah, that's the 3 things. So the 3 things, whatever I said, is what they are. Give yourself a focus. Focus your attention on the reward or the paycheck of what it is you're doing. Try to reframe or reinvent either a different way to look at it or a different way to approach it that makes it something you can feel passionate about. Or ask yourself, is it really a problem or is it really a solution? And if it's a solution, what is it solving? How can I solve it better? Thanks. Thanks everybody. That was cool. That was great. Just a few minutes too. You can listen to this on the way to work, even if your work is very close. If your work is very far, you can listen to this over and over and over again. I don't recommend that. Just listen to one of our other wonderful podcasts here on the Broken Brain Podcast. Make sure to check out the YouTube channel. This, by the way, of course, is being simulcast to YouTube and to the iTunes feed or the Stitcher feed as well, so you can hear the audio or the video of this. If you're just listening to one, you really probably want to go and do the other just to make sure you have the full experience. Anyway, make sure to subscribe to the YouTube channel if you're watching on this, and tell people about it. This is a resource I'm just putting out there because it's fun to talk about, and it's an interesting thing. Also go over to dwighthurst.com/podcast. You can get a hold of the archives and some of the other podcasts we are affiliated with that are all about basically entertaining and enlightening your life. That's all for today. We'll look forward to talking to you again soon here on the Broken Brain. Thanks a lot. Goodbye.